So our lecture today is the cardiac arrhythmia. So from the title of the lecture, cardiac arrhythmia. Arrhythmia, that means there is variation or disturbances in the normal rhythm of the heart. That means there is irregularities in the heartbeat, or there is some disturbances in the heart rate, increase or decrease in the heart beats. So it could be disturbances in the rhythm, irregularities, or in the rate and in the conductivity of the heart. Actually, cardiac arrhythmia could occur in case of healthy person as in case of exercise. So there is increase in the heartbeats. Or in case of rest. So in case of at rest, there is decrease in the heartbeats, what we call the bradycardia. Or in case of sleeping, for example. Rest as in case of sleeping, there is normal decrease in the heartbeats. And in case of exercise, there is normal increase in the heartbeats. So this is also cardiac arrhythmia. But also it can also cardiac arrhythmia may occur in case of certain systemic disease, as in case of cardiovascular disease, as in case of ischemic heart disease, ventricular heart disease, in case of obstructive pulmonary disease, in case of thyroid disease. All of these conditions also might be associated with cardiac arrhythmia. Cardiac arrhythmia also may occur due to certain medications, for example, in case of atropine or in case of phenothiazine. So these medications also might lead to increase in the heartbeats or decrease. So also it could be due to certain medications. The function of the heart, usually automaticity, which is the impulse generation. Usually the impulses or the signals generated in the sinoarterial node or in the atrium or in the ventricle. So this is called automaticity. Conductivity, when the impulses or the signals move or transported from the SA node or from the origination or the source of the impulses to other parts of the heart. Excitability and contractility. So usually cardiac arrhythmia occurs in case of disturbances in the automaticity or in the conductivity of the heart. Actually, normally the impulses or the signals generated in the SA node, sinoarterial node, and then moves to the AV node, what we call atrioventricular. That means in between the atrium and the ventricle. So it's called atrioventricular node. Then to the branches of the atrioventricular bundle, then to the Purkinje's fibers. So this is normally the automaticity or the circulation of the impulses or signals of the heart. But also sometimes, actually, the impulses or signals might be generated from other parts rather than the SA node or atrium or ventricle. And in this case, it is called ectopic impulses or ectopic signals. That means from parts of the heart rather than the SA node or atrium or the ventricles. So sometimes there's disturbances in the generation of the impulses or in the conductivity of the impulses. And this is what we call cardiac arrhythmia. For example, in case of SA node, could be there is sinus bradycardia, decrease in the heart rate, or sinus tachycardia, an increase in the heart beats or heart rates. Or sometimes there is what we call arterial tachycardia, an increase in the movement or the contractility of the atrium, or sometimes there is arterial flutter or arterial fibrillation. Regarding the ventricle, there is ventricular flutter or ventricular fibrillation in which the ventricle will be fibrillate rather than contract. That means there is no blood rather than contract. So in this case, it will lead to decrease in the blood ejected to the circulation, or blood circulation will be decreased because the heart, instead of contract to eject the blood, it will be fibrillate, and this is actually very risky. Actually, the ventricular arrhythmia is more risky than the arterial, and because usually this is lead to what we call this will lead to death of the patient because there is no treatment. It can be classified into isolated ectopic beats, bradycardia, decrease in the heart rate, or tachycardia, increase of the heart rate beyond 100 beats per minute. Sometimes cardiac arrest, which is lead to death of the patient. Actually, there are many classifications. We can say there is sinus bradycardia, sinus tachycardia, arterial tachycardia, arterial flutter, arterial fibrillation, ventricular flutter, and ventricular fibrillation, which is actually more steep because this will lead to death of the patient. The sign and symptom of bradycardia, usually the patient complains of fatigue because there is decrease in the heart rate, decrease in the blood ejected from the blood, dizziness, lightheadedness, fainting or near fainting spells. In extreme cases, cardiac arrest may occur because the heart is weak, because there is decrease in the heart rate. There is certain problem within the heart. So the heart, for example, in case of ischemic heart disease, because of myocardial infarction, the heartbeat decreased. So this will lead to sometimes to cardiac arrest, that means death of the patient. In case of tachycardia, the sign and symptom, dizziness, lightheadedness, rapid heartbeat or palpitation. This is very important. Usually the patient with tachycardia, that means palpitation, an increase in the heart rate, angina, shortness of breath, and also unconsciousness. So if the patient, when we see any patient or when we check the patient and we notice any of these signs and symptoms, that means the patient more susceptible to develop what we call cardiac arrhythmia. How we can detect patient, or what are the laboratory tests or investigation to detect the patient with cardiac arrhythmia? This is through electrocardiography. This is the electrocardiography, and this is the actually the waves of the electrocardiography detected from the machine. There is also echocardiography. Actually, we can know the amount of blood ejected from the heart, if there is weakness in the heart, if there is decrease in the heart rate, so there is decrease in the blood ejected, and this we can know actually from the echocardiography. Cardiac stress test, also we can know the heart rate, and also if there is any irregularities of the heart. The medical treatment, first of all, change in the lifestyle, and also the physician might be prescribe, or the physician might prescribe medications. For example, digoxin, which is actually the treatment of choice for cardiac arrhythmia, quinidine, propranolol, beta blockers, lidocaine as well, and comadine. Sometimes the physician may use pacemaker, which is a small device used under the skin by surgical operation, sometimes surgery for correction of certain, for example, coronary disease. Cardioversion, as we can see, this is here the cardioversion, which is the electrical shock. This is the what we call the pacemaker, which is small device placed under the skin to regulate the cardiac, or what we call heart rate, particularly in case of slowing, in case of bradycardia. Now, for dental management, we have to do any patient with cardiac arrhythmia should be medical consultation. So any patient with sinus symptom of bradycardia or tachycardia should be referred for physician for diagnosis and treatment. If the patient is already with cardiac arrhythmia, we have to consider the current status, whether it's stable or not, the nature, the type of the cardiac arrhythmia, whether atrium, ventricular, or sinus, and severity of the cardiac arrhythmia. Patient with pacemaker, we have to know the type of the pacemaker, nature of arrhythmia, as I mentioned, need of prophylactic antibiotics, because as I mentioned before that the pacemaker placed under the skin by surgical operation. So since there is surgical operation, the possibility of infection is very high. And this may lead to endocarditis, infection of the endocardium of the heart, or sometimes to endarteritis. So sometimes during dental maneuver, to dental procedure, there is bacteremia and septicemia. And this will lead to, due to infection elsewhere, so this may lead to endocarditis. So in this case, we have to consider or to have to give the patient a prophylactic antibiotic. But actually, most of the research indicated that the possibility of endocarditis